Change is not easy, especially in medicine. However,
if you listen to Canadians, be it physicians or patients over the last several years, everyone's saying the same thing. Like, we have to do better. We have to change what we're doing.
On this morning, a team at Humber River Hospital in Toronto wants to show change is possible. It can be done safely, and more Canadians can get surgeries they need.
We've done 2 surgeries so far. We start about 10 to 8. Every 30 to 35 minutes, we're sort of able to flip rooms.
Dr. Sebastian Rodriguez is an orthopedic surgeon specializing in hips and knees. His goal is to fix 14 hips in 8 hours.
Okay, see you in a bit. Breathe out.
On a typical day, one of these operating rooms sees between 4 and 5 patients, with one surgeon operating on all of them. What they're trying here today is 14 surgeries, with one surgeon moving between 2 rooms. The model is called hyper-throughput surgeries. They've done this only once before and managed 12 surgeries. One of the patients today is Richard White. Once an avid hiker and skier, White now struggles to put his own shoes on. For most hip replacements, Dr. Rodriguez makes an incision over the hip, removes any diseased or damaged bone and cartilage, then implants a replacement cup and hip socket. And that's the sound of a metal stem being inserted into the top of the thigh bone, which is topped with a replacement ball. How are you feeling?
Pretty good, actually. Yeah, surprisingly good.
The team built White a new artificial joint in about 35 minutes.
That was really fast. When I woke up in the recovery and they told me what time it was, I was amazed. I thought it would definitely be a lot longer.
So how does all that happen so quickly without compromising safety?
We did so much planning.
Mylene Vidal is a highly trained operating room nurse.
The first thing that we actually did was like instrumentations. We actually just built a tray according to what they need for the case.
A tray holds surgical tools, usually more than what's needed. Each one takes time to unwrap and prep. Smaller custom trays help cut setup times here from 30 minutes per surgery down to about 11.
I'm about to go because I'm prepared for the next one.
That's one time-saving change.
The efficient direct anterior approach.
Humber's surgical team learned other lessons from a public hospital in Belgium and a for-profit center in the U.S. By mid-afternoon, they're closing in on their goal.
We're on number 9, I believe.
To get there, they're streamlining patients to seamlessly move in and out of operating rooms. Tech-wise, the surgeon's using a measuring tool that guides placement of the implant in real time. And well-timed housekeeping teams move in as soon as each procedure is done. Just some of the small but innovative changes in the entire process.
The cumulative effect of all those minutes then allows us to add additional procedures in the day.
John V. Solanke is a nurse turned VP of Clinical Services at Humber River. As things stand, Ontario only pays hospitals to do a specific number of surgeries per year. Beyond their cap, Humber relies on fundraising dollars to do more surgeries.
We should be rewarding institutions that can actually optimize and innovate. We keep funding things like private clinics, and we keep sort of diverting the healthcare dollar.
She says the hyper-throughput model in hospitals is the type of innovation provinces should be investing in.
One of our philosophies at Humber has been, if it can be done in a private clinic, why can't it be done here?
Around 4 p.m., Dr. Rodriguez and his team wrap up their 14th patient.
It can be tiresome. It can seem a bit chaotic, but it's all like an organized dance. So yeah, I mean, I feel good because, we're able to help 14 people today that are all going to go home within the same day.
They've been absolutely amazing.
Like White, patients all went home within hours of their life-changing surgery.
They say I'll be up and walking within a few days.
While some argue hyper-throughput models are tough to replicate, others insist it's time for a cultural shift in hospitals, one that will open new doors to new possibilities.